What is multiphasic ADEM, MDEM? Multiphasic acute disseminated encephalomyelitis, often called MDEM, is a rare neurological condition. It is characterized by having two or more distinct episodes of acute disseminated encephalomyelitis, which we can refer to as ADEM. These episodes are separated by at least 3 months. During these episodes, new clinical symptoms arise, and new inflammatory lesions appear in different areas of the central nervous system, as seen on magnetic resonance imaging. To understand MDEM better, let's first look at ADEM. ADEM is an autoimmune inflammatory disorder that leads to sudden and widespread damage to the protective myelin sheath around nerves in the brain and spinal cord. This condition is often triggered by infections or, in rare cases, vaccinations. ADEM usually presents as a single episode with symptoms that can include rapid onset of neurological deficits and altered consciousness. Now, how does MDEM differ from ADEM? In monophasic ADEM, symptoms develop over days to weeks and typically do not recur within 3 months after the initial episode. In contrast, MDEM involves new neurological symptoms and new MRI lesions occurring more than 3 months after the initial episode, indicating a second or subsequent inflammatory attack in different areas of the central nervous system. To diagnose MDEM, healthcare professionals look for specific criteria. First, there must be 2 or more clinical events consistent with ADEM. Second, new MRI lesions must appear in different regions of the central nervous system than those affected initially. Lastly, there should be no evidence of clinically silent new lesions between episodes. This is crucial because it helps differentiate MDEM from multiple sclerosis, or MIS, where silent lesion formation is common. Multiple sclerosis is a chronic disease characterized by multiple relapses and new silent lesions over time. MDEM patients typically show resolution or partial resolution of lesions after attacks. New lesions appear only during clinical relapses, not silently. MDEM usually lacks the typical pattern of lesion distribution seen in MIS, although there can be challenges in diagnosing these conditions. The clinical course of MDEM is generally less common than monophasic ADEM or MIS. Patients often recover well after each attack with appropriate immunotherapy, such as corticosteroids. However, the long-term prognosis can vary. In some cases, patients may eventually be reclassified as having MIS if new silent lesions or typical MIS features develop over time. From the perspective of multiple sclerosis, MDEM is important in the differential diagnosis of demyelinating diseases. It shares some clinical and MRI features with MIS but differs in its pattern of attacks and lesion development. Understanding MDEM helps clinicians distinguish between a monophasic inflammatory event and a chronic relapsing demyelinating disease like MIS. This distinction is vital for guiding treatment and determining prognosis. In summary, multiphasic ADEM is a form of ADEM marked by multiple distinct inflammatory attacks over time, involving new areas of the central nervous system. It is crucial to recognize MDEM in the context of demyelinating diseases to ensure accurate diagnosis and appropriate management. Always consult healthcare professionals for personalized medical advice.